join you and asking Linda and myself to join you. I think Mayor Burnham basically gave my talk because my background, I'm a medical oncologist, hematologist. I was dean of the medical school. I was chief executive of the academic health system. And after I graduated in 1981 from medical school. And I would say for the last 41 years, I realized that I was actually working in the wrong space. If I really wanted to help people, I should be doing what Mayor Burnham is doing, because most of the issues, we need to get the Bank of England involved. It is a complex systems issue. It's not looking after illness. It really is, how do we maximize a whole life cost? And, I come from Singapore, and Singapore, in my lifetime, I've seen Singapore go from a young society to an aging society to an aged society. And in 2 to 4 years' time, we're going to become a super aged society, all within my lifetime. And in 28 years' time, or 27, by 2050, every third person in the UK is going to be over 60. And 9 of the 15 most aged countries in the world are going to be European. And Spain is going to be the second most aged country in the world, where nearly every other person in Spain is going to be over 60. It's going to be just behind Japan. So life is going to change very dramatically in the next 28, 27 years. The UN and WHO have really been calling the world's attention to this. And in 2017, the UN said that this is probably one of the most profound social transformations of the 21st century. It's going to affect everything: how we live, how we learn, how we work, how we play, our whole family structure. And we need a better handle on all of this. So, Linda very eloquently shared with you what the US National Commission has been, the US National Academy of Medicine has been doing with its first Global Grand Challenge. Let me just run through the recommendations for discussion. So there are 4 domains that the National Academy of Medicine called out. Linda talked about the longevity dividend, where she talked about work and retirement, volunteering, lifelong education, and retraining. What I would like to go over the goals and recommendations regarding social infrastructure, more detail about the pro-social strengths of older people, why we need to tackle ageism and age discrimination, which is getting worse and actually accelerated from COVID, social inclusion, financial security in retirement, and very important component, as Mayor Burnham talked about, digital literacy. I'll give Laura and Andrew a full set of my slides, so please, you can have a full set of the slides. The importance of the physical environment, how housing, public spaces and infrastructure, physical safety, personal safety, transportation, especially public transportation, and last mile and first mile implementation. Technologies. It's ironic that most digital technologies are designed by 20 and 30-year-olds for 70 and 80-year-old people to use. The whole issue about climate change and environmental hazards. And then how do we reform the health system? How do we deal with chronic conditions, most of which are preventable? Or if you diagnose it early enough and manage it optimally at the very start, you don't get all the complications which drive costs. How do we increase our investments in public health? The biggest returns on investment. How do we transform healthcare delivery? How do we transform long-term care? What about the healthcare workforce itself, which in itself is aging rapidly? And then how do we look at the tremendous advances in neuroscience, technology, and big data innovation? So let me just talk about social infrastructure, but in the back of your minds, I do want you to keep front and center that this is a complex system. Linda showed just the impact of work on everything else. So everything that I've described to you is an interplay of all 4 domains. And you really need a whole of society, whole of government approach to tackle this because it's a complex system. And if you don't, that O-ring is going to blow. So in terms of social infrastructure, social determinants of health have a profound influence on the life course. And these are just some examples. And we need to work in all of these areas of social determinants of health because 80% of outcomes are driven by these factors. And when I was reading Sir Michael Marmot's papers on the Whitehall studies, it really, occurred to me that actually I was working in the wrong space because I kill myself. I do work quite hard, but I can only shift the needle in about 10 or 20%. 80% of the factors are in areas which I was not working in and I'm currently trying to work in because I need to get up there to influence all these factors if I really want to make a difference. And so Linda outlined the first three goals the global roadmap. You can download it for free. Just type NAM Global Roadmap for Healthy Longevity. The report's out for free. I think it costs about $20. The hard copy just came out last week, so you can order it on Amazon. I think it's $22 or some US $22. But there are 8 goals and 9 recommendations. Linda covered the first 3 goals, and I'll cover the last 5 goals. So goal number 4 talks about social cohesion. And it's really important to get intergenerational connections because we fear that without intergenerational connections, society is going to fragment even more. And I think we're seeing evidence of this. And it's really important for us to capture the opportunities that older adults have. And Linda showed the evidence about generativity. That when people get older, they do realize that time is finite and they do want to give back. And how do we harness this potential of older people? Because currently we're only tapping into actually those people who are healthy, who actually have the economic means to give back. Why can't we tackle and harness the full potential of all older people? Now the recommendations, it's 4-1 because it's chapter 4, recommendation 1. So I'm following the numbering in the report. So 1, we really do need to tackle ageism. Again, WHO has come up and the UN have come up with great papers on this. But ageism is a very unique bias because it's a bias against our future self. It's very ironic that people should have a bias against their future self. And ageism compounds every other form of discrimination. Ageism plus sexism, ageism plus racism is just much worse. And we're seeing this in all societies. I'm seeing it in Singapore. So we really need to get out and involve campaigns, public information campaigns, harness the media to tackle this issue. I just was last week in Tokyo speaking about the NAM report, and Japan has Asia Wellbeing and Asia Health and Wellbeing Initiative. And one of the grand prizes they awarded was to a company in Thailand, a media company in Thailand, which is leading this huge campaign against ageism in Thailand. So it's really mobilizing all the assets that we have in society to address this. We need to develop the programs to connect communities, especially fostering intergenerational relationships and really enabling all people to contribute. And very importantly, we need to build in legal protections for the rights of older people and end age-based segregation and discrimination. So let me just share some of the impact of ageism. And so again, this is part of the evidence that the commission found. This was a study done 5 years ago by the San Francisco Federal Reserve, where they sent out 40,000 realistic applications. So these were applications which were really, they were fictitious people, but the 40,000 applications actually were targeting different age groups. And what did they find? Well, in those fictitious applications age 64 to 66, if you were female, there was 47% less chance of being called for even an interview if you were applying for an administrative position. If you're applying for a sales position, 36% less chance of being called for an interview compared to a younger age group, everything else being equal. For males, there was a 30% less callback if they were applying for sales positions. So this is just based on age. And what's even more frightening is, because I've been speaking to HR professionals in Singapore, and I think that this may happen in the UK and around the world, but a lot of screening for applications for jobs are actually done by algorithms. They have AI now screening, and frankly, I don't know how that AI is programmed, because so I think this is something we really need to address. Goal 5, we need to look at social protections, and very importantly, the issue of financial security. So again, in Singapore, and I understand in the United States, about 50% of people over the age of 60 in surveys are worried about their financial security. 50%. Frankly, I think everyone in this room probably has a greater chance of financial security from 60 onwards, but it's the other half of society. It's the other half of society which does not have that financial security. And if you don't have financial security, you're not going to spend money on healthy eating. You're not going to spend money going for that checkup or going for screening, especially if you feel well. So, I think we do need to give people that issue of financial security and really look at how do we, especially since, well, most people leave the workforce in their 60s, but they're living well into their 80s, 90s. In Singapore, half of children under the age of 12 are expected to live to 100. So we really need to think, as Andrew and other people have said, truly about a 100-year well-lived life, not 60 years well-lived and then 30 or 40 years figuring out how to survive. So recommendation 4-2 is that we really need to introduce support for older people and for countries without retirement income systems. How are they going to support older people? For countries with emerging retirement income systems, how do we increase security, especially for low-income people? And for countries with robust retirement income systems, how do we strengthen financial security across the life course? Recommendation 4-3 is we need to increase financial security. And we really need to look at promoting pension contributions on a much longer scale, self-funded pensions, and protecting lifelong savings. And this is where, I don't know about the UK and Europe, but we are seeing huge rise in digital scams, where we're seeing older people lose their life savings. In fact, it's staggering. I think in the last, just this year alone, Singaporeans lost about $200–300 million worth of savings through digital scams. It's frightening. And you lose your life savings at 70 or 80. It's two things happen. It's very hard to get it back, and your fear of digital technology is compounded. So we really need to work with the IT companies and the banking system. How do we protect people against digital scams, because it is rampant and we fear it's just going to get worse. So supporting structures, as I mentioned, we need laws and policies to eliminate age-based discrimination. We need public information campaigns. We need multi-generational advocacy. We need policy in action to strengthen social cohesion and reduce loneliness. We need to look at pension and social protection systems, especially protecting people outside of the formal economy. We are worried about the gig economy because the gig economy is is very attractive on a short-term basis, but the problem is what's going to happen on a long-term basis. The other issue that we're very concerned about is the feminization of aging. And I just want to digress a little bit because certainly in my part of the world, women, firstly, if they are single, they're going to, this issue about how to make sure that they've got lifelong savings. But even if they're married, they tend to leave the workforce earlier. Unfortunately, men are not carrying equal care burdens as women. And we see women leaving the workforce earlier. And because they leave the workforce earlier, and because they live longer, and very often they live longer than their spouse, the risk of financial insecurity increases. So how do we protect people outside of the formal economy? We need programs to promote individual savings and financial literacy, and very importantly, secure banking systems and investment opportunities. What happens if we don't do anything? Well, firstly, ageism costs billions annually. Loneliness, it's said that loneliness is equivalent to smoking 15 cigarettes a day. But loneliness plus any one of these conditions is actually even more devastating than smoking plus any of these conditions. And in the US alone, social isolation is estimated to increase Medicare spending by 6.7 billion annually. So it is an expensive issue. What's the return on investment? Well, firstly, social protection schemes for older people reinforce cohesion within societies while reducing poverty and inequality. And we've seen that social engagement is actually associated with better physical and mental health. And if we really want to address healthcare costs, this is one way to do so. Let me switch to the second big area, physical environment. The physical environment has an interplay. It affects work-life balance. It affects our ability to network. It affects how we live, how we play, how we learn. It affects local economies, where you cite the physical environment. And it's estimated by WHO that 24% of death and disease can be linked to environmental hazards. So it's substantial. So goal 6 is that we need physical environments that support function and engagement of people at all ages, especially older people. And we really need, as Mayor Burnham mentioned, user-centered design. So I spent 2 days in Manchester. I went to Manchester in April to actually see what they were doing. And they have this concept called the design for life. And really designing Manchester for what makes life good for people of all ages. And it sounds simple, but actually trying to implement this, what makes life good at all ages? So at the city level, I mean, we do need to look at how to address issues of climate change because older people are far more vulnerable to the extremes of weather. We need to look at it at the neighborhood level. How do we redesign neighborhoods to promote intergenerational connection, cohesion, as well as promoting walking and increased physical activity? At the home level, how do we address the existing housing stock? Because more than 60% of the housing stock for 2050 has already been built. So most of the housing for 2050 has already been built. How do we retrofit it? Because certainly in many parts of the world, just universal design for safety, there's 6 elements of universal design for safety. Some people estimate that less than 5% of homes have all 6 elements of universal design for older people. Because very importantly, we want to promote autonomy. People want to stay in their own home. People do not want to move out. How do we enable that? Mayor Burnham talked about the digital divide. It's critical. I mean, broadband access has become a common utility. Without broadband access, you can't learn from home, you can't work from home, you can't access healthcare services, you can't have food delivered. Many parts of the world do not have adequate broadband access, and also the issues of the digital divide. And public transportation. Public transportation becomes even more important when people get older because of, again, not safe for them to drive, the cost of maintaining a car. But when we design public transportation, it's the first mile and last mile, which is so critical. Because if you can't get to the bus stop or if you can't get to the tube station, it becomes a big challenge. So very importantly, we need to include older people in the design of of the physical environment. Because very often, as I mentioned, we have younger people designing for older people. It's just not the same as including older people in co-design at the very start. We need public spaces that are safe, that promote social cohesion and intergenerational activity while encouraging physical activity. We need to enhance access to food, transportation, social services, and engagement. We need programs to mitigate the effects of environmental emergencies, especially on older people. And very importantly, we need to reduce air pollution. I mean, this affects all ages, from young to old. Again, the return on investment in the US alone, they estimated over 2 years, more than 18,000 older adults died prematurely because of air pollution. Again, it's self-evident, but transportation does affect a person's ability to stay engaged and access health services. The UK did a very interesting study amongst people between 40 to 69. They persuaded a group of people to give up their car and switch. So firstly, the group of people went from active self-transportation and public transportation to driving, and they saw an increase in their BMI. When they switched back to public transport, they saw a decrease in their BMI. In Ontario, they've shown in nearly 9,000 neighborhoods that if you design it for higher walkability, you have a lower prevalence of diabetes and obesity. They've shown that if you design housing with support services, you can reduce the cost of savings in terms of emergency room visits. For every dollar spent, it's $1.57 in terms of savings. In Frankfurt, they showed that if you green the rooftops, you can lower the temperature by 40 degrees centigrade. I couldn't believe it. I thought it was a misprint, but I actually went to read the paper. A 40 degrees centigrade difference. Just imagine what you can do in saving, just in terms of energy, as well as lowering ambient temperature. We know that urban communities have much higher ambient temperature, and again, older people tolerate heat much worse than younger. Community gardens, they are great opportunities for exercise and social interaction, and in parts of the world, they create jobs, empower women and youth, and provide food security, nutrition, and health. And then the issue of broadband access. Doubling broadband access in some countries can again increase GDP. And so finally, on health systems, Goal 7 is an integrated public health and social service with healthcare, and it's person-centered, as Mayor Burnham said. It's not patient-centered. And it's really trying to look at how can we create long-term care systems to extend the years of good health and support the needs of older people. So recommendation 6-1 is really greater investments in public health, and we need to rebalance our healthcare expenditures. We need to promote prevention and wellness much better than we are doing now. And we should set 5-year targets so that we remain true to this course. Now, let me just share with you, this is OECD data on national healthcare expenditure. National healthcare expenditure, how much do countries in the OECD spend on prevention? The average is about 2.4%. Canada leads the world at 5.9%. But most of the budget is going to healthcare, looking after the sick, which we have to do. But just imagine if we could actually prevent sickness. And again, the data really suggests that most of chronic disease is preventable, or if caught early, can be treated without complications. The ROI is staggering. In high income countries, the return on investment is 14.3 to 1, cost benefit ratio of 8.3. The largest benefits are national initiatives, where the median ROI is 27.2 to 1, with a cost benefit of 17.5. And WHO has listed all the areas where there's clear return on investment. And I'll let you read those. So this is the important health pyramid, where we talk about increasing population impact going down and the greatest amount of individual effort. And you can see that you get the biggest bang for your buck with the least amount of individual effort if you address socioeconomic factors. And then the next is making the healthy choice the default choice. So banning smoking in public places or in restaurants and bars and cinemas, wearing seatbelts, wearing helmets. I mean, these are all things that have tremendous bang for the buck. We spend, so I kill myself up at the very top, taking 45 minutes to counsel a patient, trying to get people to go for their mammograms, colonoscopies. We have to do that, but the huge amount of effort and the population impact is relatively small than getting down at the base of the pyramid. So recommendation 6-2 is that we really need to shift healthcare systems to focus on healthy longevity. They need to be affordable, accessible, culturally appropriate, and as mentioned, person-centered and integrated. We have to integrate the health system from public health and prevention through healthcare delivery to long-term care. We need to align payment and reimbursement with healthy longevity outcomes, a critical factor. We need to have outcomes which are patient-centered, patient-reported, and where the patient's goals are the clear outcomes, rather than perhaps the doctor's goals. We need to make sure that all healthcare providers actually receive the training, because we're all now looking after populations of much older people. And we need to strengthen the whole area of geriatrics. We just don't have enough geriatrically trained doctors, nurses, pharmacists, allied health professionals. So we really need to make investments in this area. And one way to do that is to really, make reimbursement. I mean, right now medical oncologists, cardiologists, earn far more than the geriatricians. This is something we need to readdress. And very importantly, we need data. We need data which we give the tools to individuals so that they can see their health, they can monitor their health, and they can monitor the health of themselves and their families. So finally, goal 8, the last goal, we need quality long-term care systems for people in the setting that they desire for a life of meaning and dignity. And the word there is the setting that they desire, because many people do not want to go to nursing homes if they have the choice. How can we help them? And recommendation 6-3 is that we really need to honor people's preferences, and how do we design long-term care systems for this? So Linda shared the cost of inaction. If we don't do anything, we're going to have more people living with poor health, suffering, and dependence. We're going to have a GDP that is lower than it could be. We're going to have unsustainable fiscal burdens on government, unsustainable fiscal burdens on individuals and families, loss of contributions of older people to the well-being of society, lost opportunities. Now, we believe, and the evidence shows, that if we really invested in health throughout the life course, this will result in a realization of increased human, social, and ultimately economic capital. It's the same thing that when women entered the workforce, economies grew, they exploded when women entered the workforce. If we can retain that incredible human talent that we have, in people 60 and beyond. And the only way we can do that is if they are healthy. Just imagine the opportunities. The UK has shown that adding 1 year of working life in the UK would raise GDP by more than 1.5% over 4 years, in addition to increasing total and government capital. David Bloom and colleagues, both in the United States and in Europe, show that the economic contribution of people over the age of 60 in Europe and USA in both market as well as defined productive non-market activities. So for instance, caring for the grandchildren, that has economic value because you free the parents to go to work, amounts to 7.3% of GDP. These are stunning figures. And Andrew Scott and colleagues have shown that just in the USA alone, achieving 1 more year of healthy life expectancy in the US is worth $37 trillion in the US alone. So I hope that we've made the case to show that we really, we've reached that tipping point because 27 years is actually going to happen in our lifetime and certainly in our children's lifetime. What kind of world do we want to leave them? Thank you very much.
Thank you, John. Great talk. Questions from the floor? Yeah.
Hi, I'm Aileen Young from the Centre for Aging Better. Thank you. It was really interesting. And it's not a question so much as a comment. You know, at a time when you talk such a lot about ageism, and actually we're going to be launching a campaign to combat ageism next year, that countries that where older people were traditionally revered in Asia, that ageism is a problem there too, so that like globally the trend is in the wrong direction.
Yes. So it's interesting because we were very surprised when we saw the data because in Asia, or certainly in Singapore, I won't speak for Asia, but in Singapore, there is this issue of filial piety, and in maybe Asia it's a little bit different. We haven't seen the so-called boomer reaction, but what we have seen is that older people start putting blinkers on themselves. They sort of say, I can't do this because I'm 60 or 70. And they actually start putting limitations on themselves. So that's one factor we see in Asia. The other is that we see children perhaps being overprotective and saying, no, we don't want them to do this because of their age. And so but it's still a form of ageism and really trying to get people to de-link age from, again, physiology and functionality. And when we go down and really ask people, what do you want? Well, most people want to be autonomous. Well, everyone that we speak to, they want to be independent. They want to be autonomous. They don't want to be a burden on others. So we say, great. How do we enable you to do that? And one is, we say, you've got great value. Would you like to volunteer? Would you like to work? And how can we enable you to do so? And so we're chipping at this from many angles, but we are bringing up this issue of ageism. And actually, the people who feel very strongly about ageism in Singapore are the women. And that's great because the women really feel that they actually have the wrong end of the stick. They are living longer, financially more challenged, and so we're really shining a light on this issue.
Yeah, so it's sort of benevolent ageism and self-ageism that were the issues.
I think on that one, there's sort of two aspects of this. So I need to do a bit of a plug. I did a podcast of the Longevity Forum with Tom Kirkwood, and I'd encourage you to listen to it because Tom is always fascinating. But he just said something which I think summarizes so much of what we're talking about. Societies have tended to underestimate the capacity of older people. I think I'd add that we also, because we haven't tended to have these long lives, we underestimate the capacity of our own later years. I think there's a question about respect for older people, but also underestimating the capacity. And I think it's those two dimensions that are really important. Father Michael.
Michael Collins, thank you very much, and to Linda, fantastic talks. It strikes me also that the world of cinema could contribute enormously to the re-education of people. And I'm thinking of two movies which came to mind. One, Mrs. Doubtfire, which we've probably all seen, which was a reinterpretation of elderly women. And The Karate Kid, which also featured an elderly man teaching a young person. So maybe if you could concentrate or make an approach to the world of cinema. That might be an interesting road to develop.
Absolutely. So I'm having big discussions with the arts community because we really do think that the arts community have insight and the ability to shape thinking. I got to share with you, my children haven't seen The Karate Kid or Mrs. Doubtfire, so it doesn't resonate with them. But what resonated when I brought them to see Matisse, an exhibition of Matisse's work, and to see Matisse move through different genres and end up with paper cutting because he could not paint anymore. And yet he could create the most amazing paper prints, actually got my children saying, wow, you know, that creativity in a different dimension. And so again, absolutely, we need to approach this as a whole of society effort because we haven't harnessed that incredible capital that is not only wasted, but it's actually contributing to an increased, challenge to how our societies are going to live. But no, that really resonates. I fully agree with you.
David, you had
Yeah, question for you. How do I reconcile ageism, which there's a lot of data for, with the political power of older people? The fact that they vote with greater frequency than younger people. How do those two things coexist? And why is there not more action based upon that?
So in my country, voting is compulsory. So everyone has to vote in my country. If you don't vote, you lose the right to vote. So I can't answer, but yeah, so I think that what we do need to do is this whole element of co-design. So we need to design a society for all ages, where all ages can have a voice in where society wants to go. Linda's diagram, which she showed, was actually the most important diagram in the global roadmap. And at the center of that diagram is a social compact. And I really urge every country to put their social compact on, on the internet. Because when we did this commission, we found very few countries had put their social compact updated on the web. So we could find New Zealand and Singapore. Because without that social compact, which is explicitly declared as to what does society want, the issues of cohesion and equity will always be up to debate. And I really think that every country needs to have that conversation. And it must be a society for all. It's not a society for young, it's not a society for old, but we're all in this together because once society fragments, I think, we all see what happens. It's horrendous. We can't deal with all the challenges of an increasingly complex world. And so we need to value what each generation brings to the table. I don't know whether, Linda, you have been working this much, much longer. Do you need additional comments to make?
We're running out of time. I want to try and get everyone involved. But can I just ask one question, John? Because John is also running an extraordinary initiative in Singapore at Queenstown. And obviously you've been studying this for a long while, but through the report, was there sort of one thing that emerged from it that you thought, well, I really need to double down on that or do it in Queenstown?
Co-design. Because right now we're going to, we managed to persuade the Singapore government to allow us to adopt a township of 100,000 people. It's Manchester, a mini Manchester. But we managed to persuade all the government agencies, social sector agencies, and the private sector. And I challenged the university. I said that, if the university, we've got all the disciplines. So we know knowledge. If we know the knowledge, why aren't we implementing it to actually benefit our society? So it's this town, but every weekend I go to Queenstown and we speak with the residents. We've only been running for 1 year. Initially, it was all us talking to the residents, but now we're actively encouraging them to own it, design it, and tell us what they want so that we can enable it. So we're really trying to get that element of co-design from the ground up. And what's been really heartening is the number of youth who are coming to this. That really has been inspiring. And the youth who've been coming for this come from not only Singapore, but we've got all the exchange students. So we've got Americans, we've got Canadians, Australians, a few people from the UK, from Poland, from Spain, who are doing, they're doing electives in Singapore. They're coming, and it's a good feeling. But I would say co-design is critical.
So we're going to have a break now. I want to thank John and Linda for a great presentation. You can see how wonderful that they are presenting the topic. I also know they're very enthusiastic to talk about it. So those of you who I didn't have time to bring in as questions, do grab them over coffee, which is...
Just through the double doors and up the stairs.
Right, okay. So through double doors and up the stairs. So thank you very much, John.